If you're planning on starting a family or have just learned that you're pregnant, now is the time to see a doctor. Proper care and education before and during your pregnancy is vitally important. Women, when they're pregnant, should begin prenatal care actually before they get pregnant. It's actually called preconception counseling. However, it is never too late to start prenatal care. When you start prenatal care, it can be started as early as your positive pregnancy test. When the test is positive, call your physician and they will set up an appointment. When we see our physicians for prenatal care, we will be able to talk with them about our history, and if there are anything in our medical history, such as diabetes, high blood pressure, that might change the course of our prenatal care. The doctor will want to make sure that they take an adequate history, know any medications that you're on, as well as talk to you about the future of the pregnancy. During your prenatal care visits, the doctor will weigh you, check your blood pressure, and see how the baby is developing. As obstetrician gynecologists, we are special physicians because we are always taking care of two patients, the mommy and the developing fetus. When we are pregnant, taking care of ourselves involves taking care of not only ourselves as a woman, but taking care of our developing fetus, which will be our baby. So we want to eat correctly, we want to sleep, we want to take our prenatal vitamins, as well as we want to make sure we get adequate exercise. When we exercise during our pregnancy, not only will our pregnancy be much easier, but the delivery will also be just like an exercise routine. When you're pregnant, there are certain things that we should not do while we're pregnant. Things like smoking should not be done while we're pregnant. Alcohol should not be done in any form while we're pregnant, as well as eating certain foods. Certain foods such as cheese and certain fishes are important not to be taken while we're pregnant. When you are pregnant, you must be in tune to your body and to your baby. Things that might send you a distress signal that there might be something wrong with your pregnancy is if you have any bleeding or any change in your vaginal discharge. Other things that you might need to be concerned with is the movement of your baby. If your baby is suddenly not moving the way it was moving yesterday or in the morning, those are reasons you should call your physician. Taking education classes while you're pregnant are very important. The more prepared you are for anything in life, the easier it would be. Lamaze classes, Bradley technique, hypnobirthing, you need to choose what you think is perfect for your pregnancy. When you go in with your A game, the pregnancy will be exactly how you expect it to be. When choosing your OB or delivery hospital, you're going to ask yourself, one, what am I looking for? And when you make that decision, you're going to want to say, how close to proximity is the hospital to me? That's your most important thing because you want to get there as quickly as you need to be in case of emergency. When you choose a physician, you want to say, does this physician believe in the things that I believe in? Does she see the outcome of my pregnancy the way I would like her to be available to me? Number three, you really need her availability schedule. You want to know that she's there for you, and does her schedule mesh well with your schedule?